Okay, I had hypertension, I had diabetes before. Okay, that is way back, like probably 10 or 15 years ago, and I've been taking the medicine. There's no problem. In 2019, I discovered that I had thyroid cancer, and I had my both thyroid removed. But this cancer that I'm having now, which is actually originate from the cervix, that I discovered in early February this year, 2021. The doctor, also at the private hospital, discovered there was after the surgery, they took out a very big tumor from there. Okay, it was about probably 19 mm in size. Okay, after that, so they found that it is cancerous. Okay, so I decided to go to 𝗖𝗘𝗥𝗓𝗏. So I went to 𝗖𝗘𝗏 and they put me through tests like, CT scan and all those things, and they said, yeah, all right, but it has already spread to my liver. Okay, the cancer has spread to the liver. So one night I was browsing through the internet. Okay, I had my appointment, I was already with IJN, but at the same time I need like a second opinion. So one night I was browsing through the internet and I found 𝗖𝗘𝗥𝗓𝗏. So, and I decided to make an appointment. I just said I need to get better. At that time, my thought was just need to get better, and I can't accept that that I'm not going to live long. All right, and I went through, and I decided to go through it. 𝗖𝗘𝗥𝗓𝗏, being a public place, I mean the public hospital, they don't really explain to you. When you talk to them, also they will not be able to explain to you in depth. I prefer to come here because I get explanation.
Got it.
Alright.
Yeah.
So, well, I think I did the right thing. I did go to 𝗖𝗘𝗥𝗓𝗏 and I went for 𝗖𝗘𝗥𝗓𝗏.
Yes. Okay.
I started the IV first, yes,
Okay.
with Dr. Lee. Then I start my first chemo. That was actually, he explained to me, it's to build the immunity system, because after the Pfizer second dose, my immunity system went very low. So I went to 𝗖𝗘𝗥𝗓𝗏 to show them the result. Okay, that the blood test result that was tested here. So I showed them. At first when I told 𝗖𝗘𝗥𝗓𝗏, they said, of course your immunity system is low because you had your chemo. So the nurse will say, no, she hasn't got the chemo yet. And it's the first chemo. Oh, really? And he looked at it and he said, oh yeah. So how long would you like to postpone it? I said 2 weeks. So within that 2 weeks, to boost the immune system, so I went for the IV here. I came for the IV here, and it's proven because by the time of that 2 weeks, by the end of that 2 weeks, my immune system, we took the blood again, my immune system was so much better. So yeah, it was done IV first, then chemo started, and my chemo started, I can't remember when, I think it was in June or July, and I went for the 6 course. I started my detox after my chemo. It's the prescription that I have to take.
Okay. What is that?
Well, all those sort of
consume some herbs?
consume capsules, tablets. It's actually supplement for the body. It's not chemical.
Yes.
It's all natural herbs and all. I tell you, Dr. Lee is not just doing on my cancer also. I have stopped taking my diabetic medicine also.
Oh, yes.
Because I'm free diabetic, and I have my hypertension. I have also reduced the medicine. I had to take 3 per day last time, but now it's just 1 Yeah, there's another one. I'm also having nerve pinching here. Okay, doctor just gave me pamphlets for exercising. You know, I've been going for chiropractor and all those things, and they've been doing all this and that for me. But when he gave me the pamphlets, I just go, pamphlets, all right. 4 pages of pamphlets and with pictures on what exercise I need to do. Again, I'm a very skeptical person, but then I said, no. I told Dr. Lee that I believe in him, so I have to believe. When you believe in something, it will work, you know. And that's what. So I said, okay, all right, I'm going to believe. So I just took a few of these exercises and I will start doing it. And I said, I don't have to waste money going for chiropractor. Just look at this. It's a stretching exercise. So that is also one of the things that I'm doing. Besides the 2 types of IV, the detox and the exercise.
So like a physiotherapy.
Yes.
Okay. So it improved your.
Much improved. If you look at me now. Results. Documented results, which is they put me on another CT scan at the end of the 6th treatment of chemotherapy, and they will start comparing. This is CT scan done by IKN, and they were comparing. They said, hey, your previous cancer in your liver has shrunken. It shrinks, okay, by half, some even by more than half. And I said, what about my cervix? I was asking the doctor, what about my cervix? No longer there, no longer life-threatening. I said, oh, what a relief. And I can't wait to go back and tell Dr. Lee about it. So I think he must be waiting for the result, because he knew when I went to get my result. All right. So I went to see him on the 2nd day, on the 3rd day, because 2nd day I had something on. So on the 3rd day I came to see him and I showed him the report, and he was happy. And he said he's happy because it's a success story. It has improved tremendously, okay, in terms of the physical. Previously, when I was so weak, having a little bit of bowel movement, but you know, I've got really no problem with that actually. It has improved. Even on the appetite. I remember before I came here, I was always feeling very weak, nausea and always vomiting. Okay. So taking the treatment from Dr. Lee has improved. There are people also who was undergoing the chemo at that time, was not doing well. You know, I look around, the patients around me, when we were doing the chemo, we had patients, and they were all like, you know, very weak, on wheelchair, and I was the only one walking, driving to chemo, after chemo, driving back and everything. And they said, you don't have anyone to follow you? I said, no. I said, that because I'm fine. You know, then I asked myself, but a stage 4 person, well, they have to be on wheelchair, but I wasn't. But okay, that was the improvement. I think it's so much to do with the IV and the prescription that Dr. Lee has given, because they are all food for the body. It's boosting the immune system in my body. Okay, you know, when your immune system is low, you feel weak. Okay, you get sick easily. So I believe, and the more I believe now, within at that point, at my second point of chemo, I was already a believer, a very strong believer. And yeah, until now, in terms of health-wise, mental-wise, I'm much better. Okay, I have never been a sports person. Okay, I don't do running and all those things, but I like washing my car. Okay, I've been doing that last time when I was healthy, but when I got sick, I stopped doing it. Even sometimes, you know, to go to the car wash, and especially at that time there was MCO and all. So when you look at the car and say, oh, so dirty, but you can't do anything about it. But now that I have all the energy, I do my own washing. You know, when you wash car, it's exercise. You move every part of your body. You start sweating and everything. So that's what I do actually.
Wonderful. What comes into your mind?
I would say, I would advise them to come here,
Okay.
all right, get the IV treatment as a second opinion,
Okay.
all right, because you can't just rely on the chemo. The chemo kills your cancer cell. What it is done here, and what it has done for me here is to, when your cell is being killed or being weakened by the chemo, so this is giving food to make it, to energize it, to energize the cell back. You know, the IV, doctor's prescription and all. It energizes or it replenish your dead cell, your cell. No, I would not say dead cell. The cell that has been murdered by the chemo. So it helps to replenish. Okay, but if you're just doing the chemo alone, I'm not too sure whether, maybe it takes some time for you to heal back to normal.